what we would suggest is that primary care doctors, when they are evaluating their patients, and this goes for specialists as well, that they have in the back of their mind this very simple heuristic equation. Stress is your numerator, resiliency is your denominator. And if you ask the questions to elicit history of stress and to elicit the state of one's resiliency, then you can plan a future course for that patient that will reduce the numerator, increase the denominator, and by virtue of that fact, decrease that patient's vulnerability to these stress-related illnesses. So it's a very simple equation, and part of our job at the Benson Henry Institute is to try to promulgate this to our colleagues and so that they can integrate this into their approach to evaluating patients. So what do we suggest if, for example, your patient has high stress and low resiliency? We suggest a composite program like the one we have at the Institute, which is our stress management and resiliency training program, our relaxation response resiliency program. 8 weeks, group-based, where we teach individuals ways to elicit the relaxation response, which is a physiological antidote to the stress response, and various meditative approaches, mindfulness, various mindful exercise approaches like Tai Chi or Qigong, exercise itself, good sleep hygiene, nutrition advice, along with enhancing resiliency through positive psychology, through cognitive skills training, through social support and pro-social behavior, through spiritual connectedness. If you provide that in a group setting over 8 weeks, there are outcomes which are very promising in terms of reducing what has come to be called the metabolic syndrome, hypertension, truncal obesity, hyperlipidemia, and insulin receptor resistance. So this, we believe, is something which will help patients in terms of the quality of their life, and will help them in terms of the care of those stress-related illnesses. And we also feel that the one downstream dividend is a reduction in healthcare costs.